Assalamu alaikum. Perfect. Assalamu alaikum, everyone. Thank you so much for your patience. We are so happy to bring this program to you. My name is Zainab Husseini. I'm the program manager at Olive Community Services. We've done a few programs at ICYL, so I will skip the long introduction. You pretty much know what we do. We do these amazing programs. We bring them to you, and why they're beneficial with every topic, I cannot stress enough. I have a senior in my group, an Oliver. Unfortunately, she lost all of her siblings and her last brother during COVID, and her house is now in probate court. And nobody wants to take her case, and she's alone, she doesn't have kids, she's a widow, she's struggling. Nobody wants to do anything with her case, and if they do, they're charging a minimum of $7,000 plus. So you can imagine how important topics like this are, and to educate every person you know who owns any type of asset, they should be taking full advantage. And of course, when you add it to the Islamic aspect, there's even more rulings that we need to know. What I will say is Sheikh Joe will be talking about a charitable part. Think of Olive, think of Islamic Relief, think of all these amazing ICYL when you're talking about charitable gifts, when you're making that will, because there are organizations which would appreciate your sustainability for supporting them. So without further ado, I want to introduce both of our speakers who are visiting us from out of town. Sheikh Joe Bradford needs no introduction, but I will still go ahead and introduce him. He holds a Master of Islamic Law from the University of Medina and has studied traditionally in the Muslim world for the past 20 years. He was a VP and Senior Sharia Consultant for Al Raji Bank, the largest Islamic bank in the Middle East. Sheikh Joe sought after as an ethical finance advisor to individuals and institutions at home and abroad. He is also the co-founder of mywasiya.com, which is the website I refer a lot of our Olivers to, and I think each and every one of you should definitely visit it. Osama Estwani studied finance and business administration at Indiana University and is a founding partner at Ikhlas Insurance Group. He has over 12 years of experience in the insurance industry, specializing in Medicare and Social Security benefits. So today we're talking estate planning, Islamic wills, Medicare, Social Security. Please get all your questions answered. This is also being broadcast live on our YouTube page, so if you have kids that are putting off the estate planning part for later, make it a goal as a family to do it by 2023. Share the ICYL YouTube page with them so that they can watch live with you as well and ask questions live as well. Without further ado, can I have our speakers?
Assalamu alaikum wa rahmatullahi wa barakatuh. Jazakumullahu khairan for having us here. We're very excited for the opportunity to present about these very, very important subjects that not just a lot of Muslims are unaware of, but even people that are born in this country, live their whole lives in this country, they're also not really aware of how to navigate through these different matters. So inshallah, today our goal is to do our best to educate you so that you can understand everything as you see here, the list of the subjects that we're going to go over. Personally, my name is Osama, and I will be going over Social Security benefits and Medicare benefits. And then Sheikh Joe, inshallah, will go into the estate planning, Islamic wills, and the Sharia compliant life insurance. So first and foremost, I would like to begin with Social Security. Social Security, as I mentioned a little bit earlier, is one of those subjects, specifically Social Security and Medicare. Again, I've been doing this for over 12 years, and more than half of that, it was me working for another company where I was dealing with the majority non-Muslims in the insurance industry. And when you talk to many of the seniors that were born in this country, lived their whole lives in this country, and even dealt with these, with Social Security and Medicare, they had to deal with it with their parents. They have no idea how to navigate through it. So you can only imagine, we saw a desperate need, specifically in the Muslim community, because we also have a lot of our fathers and our mothers, uncles and aunties that are coming from overseas, coming here. A lot of them maybe didn't even don't qualify or think they don't qualify for certain benefits, be it Social Security, Medicare, or whatever it may be. So this is our opportunity, inshallah, to educate you. And obviously, and anytime you learn something that could be helpful and beneficial, that way when you get to meet, when you're with your friends in your age group and all of that, and you can advise them and help them how they could potentially get their benefits, inshallah. So first and foremost, let's begin with Social Security. You have to qualify to receive Social Security benefits and Medicare benefits. So what you see here is how you become eligible to qualify to receive Social Security or Medicare benefits. So essentially, you have to have a total of 40 credits of working in the United States, paying taxes, in order to receive retirement benefits, being Social Security, or Medicare benefits, which is health insurance. Okay, this is paid by the government. How do you attain these 40 credits? Every year of work, you can get up to 4 credits. So they're divided into the 4 quarters of the year. 1 credit is $1,640. So as long as you made $1,640 in each quarter of every year, then you will essentially qualify for retirement benefits and Medicare, okay? You won't necessarily qualify for the most amount in a Social Security check, which we will go over, and we'll discuss how you can increase your Social Security benefit amount. So if you work for 10 years, and in those 10 years, you worked for all 4 quarters and you made over the 1,600 threshold limit, then that will qualify you for Social Security and Medicare benefits, okay? That's just working in 10 years. Does that mean your Social Security check is going to be very high and something that you can actually lean on for support in your retirement? Most likely not if it's just for 10 years. So we'll go into how Social Security and the IRS figure out how much your monthly Social Security check will be. The most important thing that you need to do is, if you're 50 plus, is go to the Social Security website, ssa.gov, and create an account. Everybody should do this. And why is this very important to do? Because this will also help you with your retirement planning, okay? Because on their website, once you create an account, they have pretty much a graph that will show you where you can input, okay, I want to retire at 65. If I retire at 67, if I retire at 68, at this age I want to start collecting Social Security. It'll say with your current status, or if you continue working and paying more into the system, if you retire at this age to collect Social Security, this is the amount that you will be collecting from Social Security monthly. That insurance payment amount for you is very important, very critical to know while you're trying to plan your future, inshallah. So this is something everybody who is 50 plus should be creating an account on their website so that they can have the best idea. They also have a way where you can do your own, they have a calculator where you can put in your information without even creating a profile, but honestly, they do all the work for you, so I wouldn't even waste your time with that calculator. Just create an online account with and they have all your information saved in their system. So when are you eligible to first collect Social Security income? The earliest you can collect it, considering some exceptions, is the age of 62. The earliest you can start collecting Social Security check is at the age of 62. Your benefit will be reduced if you do so at the age of 62. When you'll be eligible to collect your full benefit if you wait till your full retirement age. And inshallah, the next slide, we'll learn what your full retirement age would be. And then the latest you should be collecting your Social Security check is at the age of 70. And sometimes the reason why people delay it to the age of 70 because there's an annual increase for your Social Security amount every year that you delay it, right? And Sheikh Joe, mashallah, he's the one who's is the professional and the experts in investing and making sure your investment is all halal and all of that. And I'm sure he can also tell you that there is really nothing that you can invest in that will guarantee, right, 8% increase every year, right, Sheikh? To absolutely guarantee it. And as we all know, with the way the markets has been for the past few years and things of that nature, nothing can guarantee that for you. So if you are comfortable financially, maybe you want to wait to collect your Social Security income, because every year you wait in collecting it, you're guaranteeing that you're increasing your Social Security check by 8%. Okay? So this is the chart that you need to be aware of to know when your full retirement age is. So essentially what the government is doing here is the full retirement age for everybody used to be the age of 65. So what they did is, you guys are also probably familiar, you've seen it on the news, both Social Security and Medicare are running out of funds, right? So what do they need to do? 10,000 people are turning 65 every day for the next several years. So there's a lot of seniors with the baby boom that are going to be turning 65 and becoming eligible for Medicare and Social Security benefits. And when there's that many people, it's putting a lot of pressure on Social Security and Medicare. So they're going to have to pay out a lot more. So what they're doing here is they're trying to push back the Medicare age and the full retirement age to collect your Social Security. So what they're doing is they've pushed it back to 67. So they didn't want to do it all at once. So what they did is the years from 1955 to 1958, they just increasing it by 2 months from there. So they pushed it up to age 66, and then 2 months after that until you get to the age of 67. So anybody born 1960 or later, the full retirement age is 67. Can the government increase it, the full retirement age, to 70 maybe? Of course they can. If they feel a need, they can. So this is something, inshallah, we always like to keep everybody informed about. So what will happen if you receive it at different ages? As we discussed, if you collect it at the age of 62, you'll be getting a permanent reduction to what your Social Security amount is. It is reduced by 25 to 30% of the full benefit amount. If you collect at your full retirement age, again, depending on when you collect, at what age, what year you were born in, that would be when you would collect 100% of your amount. After full retirement age, it increases by 8% every year after that. And that increase is a permanent increase. So whatever your amount is, you just keep on, and it maxes out at the age of 70. This is something very cool to get an idea of, is how much Social Security can you actually make every month, right? Because sometimes some people I've seen make only $200, $500, $600 in Social Security. Someone might say, brother, I've been making so much. I make $200,000, $300,000 a year, and the government takes money out of my paycheck for Social Security and Medicare. How come I'm not getting that much? We're going to go into that. On average, Social Security beneficiaries that get Social Security income on a monthly basis, they're collecting about $1,600, $1,700 a month. This will be in 2023. On average, that's how much people collect in the U.S. The maximum amount someone can collect in 2023 in Social Security benefits is $3,636. That's a pretty decent income, okay? How can you maximize your Social Security benefits? It's maximized with how many years did you work in the U.S., okay? So as you know, the Federal Insurance Contribution Act, they take money out for Social Security and Medicare every month from your paycheck. 6.2% of your paycheck goes towards Social Security, 1.45% goes towards Medicare, right? So in order to receive those benefits when you retire, that's how much comes out of your paycheck. They stop collecting that amount once your income in that year reaches $160,000. So once you get to $160,000, they're no longer deducting for Social Security or Medicare, right? So if you made that much income, if you maximized your income every year, that will also push up, that will increase your Social Security payment monthly. So what they do is they take the average income over 35 years. So for example, if you moved to the US 10 years ago, 15 years ago, and mashallah, you're a doctor and you make much more than $160,000 a year, you might think, I should be getting the maximum amount. Not necessarily. Because, say for example, you worked for 20 years in the US and you were maxing out how much you made. What happens here is, what's the IRS going to do for the other 15 years, from 20 to 35? They're going to put your income as zero. So what's going to happen when they average that out? It's going to bring down your average significantly. Therefore, you'll see that your Social Security monthly payment is going to be significantly less than what you may have expected. Again, to get the best idea for this, create that account on the Social Security website. When do most people collect their Social Security benefits? This is a chart here that has an estimate of men and women at what times they start collecting. As you see, the majority of the people are collecting at the age of 62. Generally, my advice is collect at 62. The sooner the better, if you need the money. Okay? If you need the money, collect it immediately. Don't wait. At the end of the day, we all don't know how long we're going to live here, right? Our lives are in the hands of Allah subhanahu wa ta'ala. And one of the most important things that you need to consider is, what's the break-even point? If you do wait to collect at the age of 66 or 67 for your full retirement age, right? But there was about 4 or 5 years in between that period where you could have been making money every single month, being paid by Social Security, right? So the break-even point is really not until the age of 75 to 80 for you to actually make up the difference if you collected earlier. So it's very important to keep that in mind when you want to collect. We have a lot of material, so we will have questions, I promise, inshallah. We'll make time for
being recorded?
it is being recorded, I believe. So we do have time for questions at the end. But for the sake of going through all the information, if you could please just take note of your questions, inshallah. However, if you don't need the money and you're comfortable financially, we do recommend waiting, again, because you're increasing your benefit amount. And also there's another reason why waiting could be beneficial, not just to increase your amount, but some other reasons that we will go over, inshallah. Next year in 2023, Social Security is increasing the cost of living adjustment by 8.7%. So on average, people who receive Social Security benefits are going to be making around $100 more a month in their Social Security check, which is great because this is actually the highest increase COLA adjustment since 1980. And as you know, it had to be done because just inflation has been ridiculous and everything is so much more expensive these days. This is one of the reasons why you might consider not collecting at the age of 62. Are you working? Are you making money? If you collect anytime between the age of 62 and your full retirement age, for every $2 you make above the threshold of $21,000, the government is going to request the dollar back. So they're taking back from the Social Security income that they gave you. So you could essentially be losing it. Does that mean you're losing it forever? No, not necessarily. What that means is the government is going to consider as if you didn't even collect Social Security during that time. Even though you were collecting, they're going to consider that you weren't collecting. So actually your Social Security amount does have the potential to grow. But this is also something to be aware of because when tax time comes and you have to owe back all your Social Security amount, if you already spent all your money and then you have to pay all this amount back, you need to be aware of this so that you don't have a lot to owe back to the government when you do your taxes. In your full retirement year of when you were born, like say for example you turned 65, so now we're in the year of anybody who was born in 1957 turned 65 in 2022. Okay, so until they turn 60, or until they turn to the age of their full retirement age, the threshold goes from 21,000 to 56,000. If you earn for every $3 you earn above that, the government will take $1 back. Okay, but once you reach full retirement age, and after that, there's no more income limit. You can make $1 million, $2 million, mashallah, make as much as you want, inshallah, and there's no benefit reduction. Okay, you can collect your social security check. Okay, something that's very important to note here is this is based off of your income only. So if you want to collect social security and you don't make any income, but your spouse makes $500,000 a year, right? I say big numbers here because we're in California, mashallah. So if your spouse says $500,000 a year and you make no income, then that doesn't impact your social security. So this is just, whether you file joint or not, this is only what your income is specifically. Spousal benefits. One of the biggest questions that we get in the Muslim community is, well, the spouse didn't work. MashaAllah, may Allah bless them. They took care of their family, they took care of their kids, but they didn't work. Do I qualify for Social Security and Medicare? Of course you do. You do from your spouse that did work. Okay? So you will be able to qualify for up to 50% of what their benefit is. So if you do collect at 62, you'll get a partial benefit. And the closer you collect to your full retirement age of the spouse, you get closer to the 50%. So if you collect at, for example, 62, you're going to get 35% of your spouse's amount. The more you get closer to your full retirement age, it becomes 40%, 49%, etc. Until, if you wait until your full retirement age, you get the full 50%. And this is why it's also important, if the spouse does make a lot of money, and they could increase the Social Security amount by waiting. When you're increasing your amount, your spouse is also collecting 50% of your increased amount. So this is of the benefit of waiting. Survivor benefits. You can start collecting Social Security income as early as the age of 60 if your spouse passes away. Okay, so it goes up 2 years if your spouse passes away. Now it increases. You'll get 71 to 99% of your spouse's Social Security check if you start collecting at 60 years old. So at age 60, you decide you want to collect from your spouse who had passed away, you'll get about 71.5%. If you wait until your full retirement age, then you'll get their full check. So again, this is the benefit. If there's a big age difference between you and your spouse, and you know your family history is not very good in health, etc., or whatever it may be, and you want to increase their Social Security amount, this is a way to do it. So generally, there's a lot of collection strategies, okay, for collecting Social Security, thinking about your spouse, thinking about all of these things, right? And life expectancy. I know as Muslims, we never know when we're going to pass away. I could pass away before anybody else. We don't know what our life is going to tell. However, we can also see historically with our families, our fathers, our mothers, our family history and health and all of that, to try to get an idea, because we need to work smart to see how we can also potentially protect our family and how much they can receive in Social Security, okay? So if you have any questions, anytime we give any Social Security advice or assistance with this, we never charge anything. We do a lot of services at Ikhlas for no consultation fees whatsoever. Now we go on to Medicare, inshallah. So Medicare is just like Social Security in how to be eligible for it. You have to have the 40 credits, okay? So what Medicare is made up is original Medicare is Medicare Part A and Medicare Part B. This is what the government gives you. The rest of the things that you see about Medicare, you have to get on your own, okay? So the government gives you Medicare Part A and Medicare Part B. Medicare Part A is your inpatient services. So anytime you get admitted to the hospital or a skilled nursing facility coverage, in short, like if you go to a nursing home for rehabilitation. Medicare Part B is your outpatient care. So anytime you go to the doctor, anything outpatient essentially, anything that's not being admitted into the hospital, doctor, outpatient surgery, even durable medical equipment, anything like that. God forbid, cancer treatments, all of that. This is covered under Medicare Part B. So it's not covering prescriptions, it's not covering dental, it's not covering anything of such. This is what the government gives you, and this is what you pay towards. How much does Medicare Part A cost? Well, it could cost anywhere between $278 to $506 a month. So that's a lot of money. Why would it cost this much? It would cost this much if you didn't get your full credits to be eligible for Medicare benefits. If maybe you had 30 credits or 25 credits, you still are eligible to have Medicare Part A, but you have to pay for it now. If you get the full 40 credits, then you get Medicare Part A for free. So once you get to the full 40 credits, Medicare Part A will be free. If you don't, you can purchase it for an amount. How does Medicare Part A cover your hospitalization stay? Per admission to the hospital. If you have nothing but original Medicare, just that red, white, and blue card, you have to pay $1,600 per admission to the hospital. Okay? So you go into the hospital, you leave, a few months later, you go back to the hospital, you're paying $1,600 again. So anytime you get admitted to the hospital, you have to pay $1,600. That will cover you for up to 60 days. However, if you are in the hospital for more than 60 days, 61 to 90 days, you have a $400 co-payment daily. You have a daily co-payment of $400. If you're there 91 to 150 days, you have an $800 daily co-payment. You have an $800 daily co-pay. That's a lot of money. And then Medicare will not pay anything for 151 days or more. That's why we need solutions for this, and we're going to go over the solutions for it. So Medicare, yes, they're giving you something, but they're really not giving you that much. Part A continued. If you do get admitted into a skilled nursing facility, I don't want to get into this too much. There is a way, there's a huge loophole in Medicare where sometimes Medicare will not pay for your recovery care stay at a skilled nursing facility. And in short, if you're in the hospital for 3 days inpatient, 3 nights inpatient, then Medicare will give you this coverage. However, if you're not in the hospital inpatient for at least 3 nights, then Medicare will not pay a penny for your skilled nursing facility stay. And skilled nursing facility visits are north of $20,000. So a lot of people are unaware of this, and this is something that is very important to be aware of. There's actually a document that when you go into the emergency room that you sign up, that tells you that you're signing off that you're in observation status, and it doesn't count as an inpatient stay. If you do qualify to get coverage by Medicare for a skilled nursing facility, Medicare will cover the first 20 days at a rehabilitation care, right? So for example, may Allah protect you all, you get a stroke, heart attack, or something, you fall, you're fine, you don't need to stay in the hospital, you just need nursing care, rehab, and all of that, maybe for a week, 2 weeks, a month, or whatever. This is what this coverage is. So Medicare will cover the first 20 days, 21 to 100 days, you have a $200 daily copay that you have to pay out of your pocket. Over 100 days, Medicare pays nothing. That goes into like long-term care and stuff like that. This is not what this is. That's everything you need to know about essentially Medicare Part A coverage, okay? Hospitalization and recovery care. Now we move on to Medicare Part B. Medicare Part B is the most common one, right? Doctor office visits, specialists, cancer treatment, outpatient surgeries, lab work, all of these things, anything outpatient. Medicare Part B does have a cost. Whether you have 40 credits or not, Part B will cost you $164.90 next year. Actually, something unheard of happened. This year it was $170 and change, and it's going down to $164 next year. This will come out monthly from your Social Security check. If you are not collecting Social Security, they're going to deduct it from, they're going to send you a quarterly bill. So you might be surprised with getting a big bill for the cost of Medicare. They don't tell you this on the bill that they send you, but you can send it in monthly if you can't afford to pay the whole quarterly amount. But you have to remind yourself, they're not going to send you updates that you have this balance left. You have to send it in every month. Now, this chart right here, let me see if I can, shows you how much the government essentially will penalize you if you make more money as a senior. So for example, if you're filing joint and you make over $246,000 a year, you're not going to pay the $164, you're going to pay $329 a month for your Medicare Part B. So essentially, in short, and all this information is also on our website, in short, you're going to be penalized for making more money and you're on Medicare Part B. But generally, the majority of the seniors pay $164 for their Medicare. What's the coverage like? Okay, we already saw that there's a lot of holes that Medicare doesn't fill for you with hospitalization. Similarly here, and actually even worse for outpatient services. You have an annual deductible of $226 for outpatient services. Now that deductible is not bad because it's a one-time deductible, once a year, that's it. It's a very small deductible. But the worst part about it is what's next. Medicare pays 80% of all approved charges. You're left alone to pay the remaining 20%. Okay? 80% sounds like a lot, but do you know what else is a lot? 20%. Especially if there's no maximum out of pocket. If you've ever had an insurance policy through an employer or Obamacare, even the Obamacare maximums are so high, like $10,000, $15,000 sometimes, I'd still rather have a $10,000, $15,000 maximum out of pocket instead of having no maximum. So this is unlimited risk. This is 20% nonstop. This is 20% of every doctor bill, every outpatient surgery, every cancer treatment, 20% of every outpatient service. So this has unlimited risk, and definitely you must have a solution for this. What does Medicare not cover? Most dental care, eye examinations, so any visit to the optometrist. A lot of people confuse this with eye doctors, like medical eye doctors. Medical eye doctors are covered under Medicare Part B. So when you go to an ophthalmologist, that's covered. So like for eye diseases or disorders like macular degeneration, retinopathy, glaucoma, cataract surgery, this is all covered under Medicare. This has nothing to do with this. This is just for like glasses and vision exams. Hearing exams and hearing aids, which are very expensive, Medicare does not cover. Acupuncture, long-term care, some cases of skilled nursing facility, which we alluded to a little bit earlier when we were discussing that. When can you enroll into Medicare? Okay, if you're not on Medicare disability, that has its own rules. So some people might have Medicare under the age of 65. These are people who are on Medicare disability. These are people who are receiving Social Security income. Once you qualify for disability through Social Security, you become eligible for Medicare benefits after 2 years of that. Okay, that has its own rules and things of that nature. We're not going to go too much into that right now. Our focus here today is the seniors. So the initial enrollment is your 65th birth month. Okay, so your effective date for Medicare would be the first day of your birth month. And you can begin to enroll 3 months before, and they give you a window to enroll 3 months after. If you don't enroll 3 months after and you want to enroll after that, you can't. You'll have to wait until the Medicare open enrollment period, and then your effective date will not be until the following July of the following year. Okay? And you will be penalized by Medicare for not having Part B for X amount of months. And that penalty will be on your Part B premium for life. So be very aware of these dates. What are the solutions for Medicare Part A and Part B? As you saw, all those numbers in the red, that's what you would be responsible for if you only have original Medicare and you don't take any additional coverage. So there are 2 solutions for this. And right now we're going to go over solution number 1. Solution number 1 is the safest solution. It's the one that I personally recommend. However, this is not what I offer everybody because it depends on your circumstances. This is the safest solution. Why? Because with solution number 1, you keep Medicare as your primary insurer. When Medicare is your primary insurer, you're not dealing with networks and contracts with providers and doctors and hospitals that can expire, and then your doctor's out of network and all that mess, right? Medicare is your primary insurer, meaning there's no network. You're covered the same here in California as you'd be anywhere in the entire United States. Especially if you travel, this is great. And you'll even get foreign travel emergency coverage of up to $50,000. Okay? So here you maintain Medicare as your primary, and then you take a Medicare supplement plan to supplement what Medicare doesn't cover to be your secondary insurance. So as long as your Medicare is accepted, doesn't matter what the name of your secondary company is, it will be accepted. Okay? These are all the Medicare supplement plans that are available. In 2012, Medicare standardized all the Medicare supplement plans. Therefore, Medicare made these benefits. No insurance company can add a benefit or reduce a benefit or remove a benefit. They're all selling apples. You're comparing apples to apples when you're comparing companies. No company can give you better benefits than another company. Anyone tells you that one company is better than another company when it comes to Medicare supplement, they're not telling you the truth. They're just trying to maybe sell you something that's more expensive. This is why we always recommend the company with the lowest price for Medicare supplement plans, because by law, they're required to give you the exact same coverage. Okay? Now, prices are different from zip code area to counties, etc., and state to state. Sometimes we get calls from people that we work with in Florida. They'll be like, "Why am I paying so much? My brother or my sister in Texas pays so much less." Right? Well, you're living in a different state. There's different regulations and things of that nature. So, Medicare supplement plans. The most popular plans are Medicare Plan G and Plan N. You'll see them right here on the side, right? So this area right here, these two columns, is what Medicare covers. The red is what you would be responsible for if you didn't have these solutions, okay? We're going to focus on Plan G. It's the most popular plan. There's really only a price difference monthly between Plan G and Plan N, anywhere between $15 to $20 some a month when you're comparing some companies. Plan G is going to be the safest one. So for now, we're just going to go over Plan G. So Plan G, essentially, as you see, there's check marks next to everything that Medicare doesn't pay for your hospitalization. So that per admission deductible of $1,600, the daily copays of $400 and $800, Plan G will pay it. So essentially with Plan G, if that's the plan you choose, no matter how many times you go to the hospital in a year, for how long, you will never get a bill, guaranteed, from the hospital. Okay? For a skilled nursing facility, Plan G doesn't need to cover your first 2 days if you go to rehab care, because Medicare pays the first 20 days anyway. They do pay the daily copay of 21 to 100 days of $200 daily, and they don't cover anything beyond the 100 days because Medicare doesn't cover anything, okay? Because again, this is supplementing Medicare. They're not giving you any additional coverage, okay? So that's how Medicare Plan G covers your Part A. So how does it cover your Part A? At 100%. You're never going to get an inpatient bill, essentially, okay? You can go to any hospital that you want. How does it cover your Medicare Part B, so your outpatient care? The only thing there's not a check mark next to is the $226 annual deductible. And that's a very little deductible. So once you pay $226 for any outpatient service, so say for example, in January, you go to your heart doctor and the bill is $300. All you pay is $226. And then for the rest of the year, Plan G picks up all the bills. No matter what you do, outpatient surgery, treatments, lab work, diagnostics, all these things. So it'll pay the 20% unlimited. So essentially with Medicare Plan G, and the prices for Medicare Plan G can range anywhere between $100 to $125 a month for someone who's around the age of 60, okay? You pay that monthly, you're guaranteed not to get any bills, inpatient or outpatient. Now, sometimes you do get a bill, and we've had many cases of our clients getting bills. You just send the bill to us, to our customer service, and we contact the doctor's office or the hospital, and we make sure that the bill gets paid. You should never get a bill, okay? The coverage is guaranteed by law. Usually if you get a bill, someone in their claims department didn't know what they were doing, they filed it incorrectly, and you get a bill. So why is Medicare supplement plan the safest option? I'm not saying it's the best option, because best option depends case by case. It is the safest option, and actually for someone who can afford it, it is the best option, right? Because you pay your monthly amount, you know exactly what you need to budget for your health care, right? You're not going to get surprised with a $1,000 bill, several co-payments to the doctor's office every month, and it starts adding up. You know what you need to budget for your health care. As a senior, you're living on fixed income, whatever it may be. There's no risks involved. And you never have to worry, is my doctor going to be in network? Am I going to, even if with the other option, if I go out of network, is my copay is going to be even higher or doubled or whatever it is, right? So you pay your monthly amount and you live worry-free. Every visit you do to a doctor or a healthcare provider, you pay nothing for it. So as we said, Medicare supplement plan doesn't give you additional coverage from what original Medicare gives you. It just fills in the gaps. That's why Medicare supplement plans also has another name. They're called Medigaps, essentially filling in the gaps that Medicare doesn't cover. You have to take a standalone Medicare Part D prescription plan. So think of D for drugs, okay? You have to take a plan to cover your prescriptions. So when you're comparing different plans, to be honest with you, we can sit here and talk about how to choose one plan over the other. But the bottom line is, what we do is we get a list of your medication, and anybody can do this, even if you don't want to contact us or anything like that. You go to Medicare.gov, the government website. They have a program on their website. You put in your zip code, you put in all your medication. It will give you a non-biased list of all the Medicare prescription plans available. And they break it down by how much it will cost you yearly with the plan and the prescriptions. We always recommend going with the plan that is going to cover your prescriptions at the best. That's honestly the best thing to do. We don't need to go into there's no plan that covers every prescription. Sometimes people will say, I'll pay $40, $50 a month for a plan that covers all the There's no plan like that, right? Prescription plans will be anywhere between $8 to $20 a month. There is an enrollment penalty if you don't sign up for a prescription plan. So say, for example, you say, I don't take any prescription plans. I don't know why I should sign up for one. Well, you should. Why? Because Medicare will penalize you 1% for every month you don't have a prescription plan. So when you decide to get a prescription plan, you'll have a penalty. It's 1% of the national average of what a prescription plan costs. So essentially the penalty is usually around 33 cents for every month you don't have one. So let's say, for example, you didn't have one for 24 months times 33 cents. That's almost an $8 penalty for life. So where does that penalty come from? If your prescription plan is $20 a month, the actual plan, they're going to add about $8 to that, and that $8 goes to Medicare. You're penalized. Now, if your months, I've had some people not have prescription plans for 60 months, and they have to pay sometimes double for their prescription plan, and there's no way around that. So I always recommend, if you don't take any medication, just take the cheapest plan out there. So that is solution number one. Solution number one is going to cost more. So if you're only collecting $400, $500, $600 a month in Social Security, and you can't afford to pay $100 a month, or you can't get your groceries, which sadly there's many circumstances I see that, you're not going to want to take a supplement plan. Okay, you're going to need another option that's cheaper. Okay, because you just can't afford to pay that money monthly, and then you'll just figure it out with what else is available. Okay. Or we also have some people, especially, mashallah, in the Muslim community, like, I don't believe in insurance, I'm very healthy, nothing, I trust Allah subhanahu wa ta'ala, I'll be fine, I don't need to worry about that. Great. But there's a big risk when you stay on just Medicare. The risk is, what did we say? The unlimited costs that you could incur. No maximum out of pocket. So how can you protect yourself, even with a cheaper option, is option number two. Option number two are Medicare Advantage plans. Medicare Advantage plans are heavily advertised by the insurance companies. You cannot turn on the TV during the daytime and not see a million Medicare Advantage commercials, right? Why are insurance companies heavily marketing Advantage plans and not marketing supplement plans? Because yes, exactly. They make so much more money with Advantage plans. But how can they make so much more money? Advantage plans are usually what? Free. The commercial's just like this. For $0 a month, you will get hospital, medical, prescription drug coverage, and we'll even give you transportation to your doctor. We'll even pay for your groceries. We'll even deliver food to your home. You will give you free gym membership, dental care, vision care, all of these things. And then they get like some famous celebrity from the past that does this commercial, right? It sounds too good to be true, because it is too good to be true, okay? What happens here is, again, me personally, I've given people Medicare Advantage plans, but under specific circumstances, right? And the specific circumstances are, as I said, three circumstances. One, either they can't afford a supplement plan and they need something, because at least with Medicare Advantage plan, there's a maximum out of pocket. Sure, it might be high. Now with HMO plans, they're less, but HMO plans are not too good, okay? But we're going to discuss this. They might be less, 2,000, 3,000. The reason why HMO out-of-pockets are less is because the insurance company knows for sure you're going to people they have a contract with. So they know how much money they're going to have to pay out. They don't want you to go out of network because then they have to negotiate and they might have to pay more. They don't want to pay for you. If an insurance, and trust me, don't ever be loyal to an insurance company. Because if they had the choice to drop you because you had a lot of medical conditions, they would drop you. But there's laws to do that, okay? To them, I've even had calls from insurance companies. They're like, well, this person is costing us a lot of money. Okay, what do you want me to do for you? Like, you have no choice, right? So the bottom line is a lot of these insurance companies, they don't really care, right? So what we do is we try to help you find the best solution in a system that just is what it is here in the United States. So at least with the Medicare Advantage plan, there's a maximum amount of pocket. So case number one is if they simply can't afford one, at least you'll put a maximum on how much what your risk is going to be. Case number two is someone, as we alluded to earlier, is very healthy, never goes to the doctor or anything like that. They don't believe in insurance. Take it. At least you put a cap on what you pay. Case number three, and which is the majority of the time, I would choose an Advantage plan, and an Advantage plan would actually be the better option, much better option in this situation, is if they're dual eligible, meaning they're eligible for Medicare and Medicaid. You get dual eligibility here. So you're getting pretty much full coverage, and then a lot of the dual Medicare Advantage plans give you all these extra benefits like dental and all of that, and it's also zero coverage and you can go almost anywhere you want. Now that differs from not just state to state, it differs from county to county, so you'd have to do some research to see if those kind of dual plans are available in your area. These are dual Advantage plans. So Medicare Advantage plans pretty much cover everything. It covers what Part A covers, Part B, Part D, which is what makes Part C. So hospital, medical, and prescription. So again, how can these insurance companies that want to collect as much money as possible, how can they give you something for free, right? Because what happens here is when you sign up for a Medicare Advantage plan, now Medicare is not responsible for you anymore. You're pretty much forfeiting your Medicare coverage as long as you're under the private insurance company, right? Not exactly, they won't say it like that, but to be honest, that's really what's happening, okay? Medicare will then pay at least minimum $1,000 a month to the private insurance company. Now Medicare is saying we're not responsible for you anymore. The private insurance company has to deal with you. Okay. So if you take a supplement plan, how much are you paying monthly to an insurance company? 100, 120, 150 if you're in your 70s, 170, right? What do you think the insurance company prefers? Collecting $100 and some a month or over $1,000 a month? Of course, over $1,000 a month. That's why they will give you all these additional benefits and all of these things, right? So the insurance companies are making more. Guess who else makes a lot more money with the Advantage plans? Not just the insurance companies, but the people who sell Advantage plans. The commission is like over double. Like especially actually here in California, the commission for someone who sells it is significantly higher than almost all the states, right? So I'm telling you this and I'm warning you. If you have a plan that you like, don't just listen to anybody on the street. Because I've heard many people who only sell Medicare Advantage plans, they call you. I'm sure you seniors in here, you get a lot of phone calls. The people want to change your insurance. They say, we'll give you a plan for free. All your doctors are in network. You'll get this, 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 this. They promise you the world, and then you get the plan. Maybe your doctor's not even in network. You have to pay copays, and you have to pay this, and you have to pay that, right? So be very, very careful. Do your research. And also, please, never give your social security number to anyone over the phone. Don't give your banking information to anyone over the phone. Even if you wanted to go through us and I call you, tell me, I will call you back. Okay? Because honestly, even sometimes people use our name when they call people. Like, oh, we're the Clause Insurance Group, right? I don't know how they get this information, but they do, right? Even if I say I'm calling you, the only time you can give that information over the phone is when you know who you're calling, okay? You know you're calling that person. If someone just calls you and says, give me this, never do it. I've seen cases sometimes where a senior, someone got all their information over the phone, they took $40,000 out of their bank account. And there's nothing they were able to do about it. So be very careful with the information that you give over the phone. So again, I'm not here saying that Medicare Advantage plans are terrible. I'm just trying to educate you so that you can be aware of how some people work in this industry, okay? So to be very careful of that. In some cases, it could be a good option. So some pros and cons of Medicare Advantage plans is obviously zero premium. If you're very healthy and you never get sick, I mean, it's fantastic. They do give you some dental coverage. They give you all of these things. Now, the biggest con about it, again, is there's a high maximum out of pocket, and you're limited to whatever network that the insurance company sets for you. And I had a case, I was actually talking to Sheikh Joe about it yesterday, someone who was switched to an Advantage plan, and they have cancer, like throat cancer. And the doctor is sending scripts for certain tests to be done, and I'll show you the text messages. He said the insurance company keeps on denying it. It's an Advantage plan. And he said this, excuse my language, but he said this to me by text. He said, who the hell are these insurance companies to decide whether I can get tested for a certain thing or not? My doctor is asking for this. So unfortunately, these are the types of cases that we run into with Advantage plans. So networks. You will have a network with the Advantage plan because the private insurance company is your primary. You have HMO, you have PPO, okay? I would always recommend taking a PPO over an HMO at any time. The only time I would say okay for an HMO is if it's a plan with a very, very low maximum out of pocket, and you know for sure you did your research and all your doctors and your hospitals are in network and you're someone who just doesn't travel. You stay put. Because once you leave your service area, you get no coverage. Okay? And with the HMO, you have to have a primary care physician that you get everything done through them. They have to refer you to see specialists. Okay? Whereas with PPOs, you can also get zero premium PPOs. You can get coverage statewide and nationwide. There's out-of-network coverage. Now, they do have an in-network maximum, and they also have an out-of-network maximum. So that does add to how much you have to pay. You don't have to have a primary care physician that you go to for everything, and you can just go to a specialist if you like. One of the disadvantages with the Medicare Advantage plan is the fact that they have high hospital copays, right? So they have high hospital copays where you could pay anywhere between $200 to sometimes $400 a month. Again, it depends on your area. Every county has their own Advantage plans, okay? So there's thousands of different Advantage plans. I don't know all of them, right? So even for me, when I help people out, I have to ask them for their zip code and I have to see. Generally, I know how they work. You have to pay that for anywhere between 3 to 6 days. So even with their copays, your trip to the hospital could be anywhere between $1,500 to $2,000 every time you go to the hospital with the Advantage plan. So pretty much that sums up what an Advantage plan is. Again, don't feel bad if Advantage plan is the best option for you. Alhamdulillah, at least you have something. But generally what we do advise is the safest option would be to take a Medicare supplement plan. But again, for some people, Medicare Advantage plans work well. Finally, almost your turn, Sheikhna, is if you're working, right? If you're working and you want to retire, or you decide that your employer coverage is too expensive and you want to give it up and go onto a Medicare plan and you're 65 plus, you have a 60-day eligibility period. So first and foremost, you'd be deferring your Medicare Part B. When you're 65, you defer your Medicare Part B. You tell Social Security that I don't want it. When I retire, I'll take it. So you defer your Medicare Part B. When you defer your Medicare Part B and you start it, then you'll have your initial enrollment period, which becomes the 3 months. But if you already had your Medicare Part B in place at the age of 65, because some employers have their own Medicare type plans, right? And you leave their Medicare type plan to go on to Medicare on your own, then the government will give you a 60-day special enrollment period. Okay, that's very important to know, because if you retire or leave your plan and you're outside of those 60 days, then you can't sign up, right? You lose your enrollment period. So these are some very important things that you should keep in mind. And for those of you that are younger here, mashallah, And this is not for your age group, but you have elders that are very important and dear to your life, your mother, father, uncles, aunts. These are some important information that you can share with them next time you're on the dinner table, like, oh, I know about this, and you give them some answers, inshallah. And if there's ever anything that we can do to assist, inshallah, we'll be answering questions at the end, inshallah.
Okay, Assalamu alaikum, everyone. So now we're going to move on and talk a little bit about. Now we're going to move on and talk a little bit about estate planning, wills, and all that good stuff. I think one of the things that really must be said is that the information that we're going over doesn't necessarily have, as Osama kind of pointed out, yes, it has an applicability age, but quite frankly, many of us in our community are lost as to how to effectively help our parents, our peers, and our coworkers. We don't know the benefits that we have that would not only allow us to benefit ourselves, but also reduce the burden on our families in general, when we don't have to, for example, place a burden on our children. So, regardless of your age or your need for this, the one thing that we, Osama and I, when we talked about doing these seminars, we want people to walk away with is education and a sense of responsibility to do something. You don't necessarily have to use any services that are being presented or names that are being mentioned, but what we need is for you to do something. The number of families that will call with financial distress because a loved one is in the hospital or they've passed on is very high. For a community like ours that has considerable amount of wealth and upward mobility and access, it's very unacceptable for us to not take full advantage of everything that is provided to us and that we have the ability to organize ourselves around. So this is this disclaimer, basically says everything here is educational. I'm not offering you legal, financial, ethical, or any other kind of advice. We're just educating, which is the purpose behind all